Welcome back. We continue our conversations here live from Davos 2025. Healthcare continues to be an area that the World Economic Forum puts a lot of focus on. And joining us now to talk about what the healthcare roadmap for 2025 looks like is Shyam Bishen. Many thanks, Shyam. It's great to have you back here in our studios in Davos. So let me start by asking you about what you see as the big challenges as well as the big opportunities on the healthcare side.
Thank you. Thanks, Shereen. Thanks for having me on this program. This year, we are looking at the digital side. We are looking at digital healthcare. We are looking at AI adoption, how some of these new and emerging technologies can help us solve for access side, for outcome and efficiency. As you know, that we have serious challenges when it comes to access of healthcare deliveries of healthcare products and services. And we have challenges in terms of the healthcare cost. So we do need to gain operational efficiencies. We do need to get better cost structure overall in the healthcare system. But access is an area that we will focus quite a bit this year. Another challenge is on the climate side. As we see the global warming, as we see extreme weather events, we do see many more healthcare-related challenges, health challenges, whether it's mental health, whether it's respiratory, it's cardiovascular, and obviously the infectious diseases. They are all going up. They are all increasing because of the climate change. And we want to make sure that we prepare the health system to tackle that. And again, I believe that the digital technologies will help us quite a bit in that area.
You talked about digital technologies as well as AI adoption. Let me ask you this in the context of the work that's happening in India, because I know that, you've previously said in the World Economic Forum has believed that India can be a global pathfinder in global health, and that it's not just a national story. The digital health story in India is not just a national story, but it is a global opportunity. So why do you believe that India can be a pathfinder when we talk about digital health?
Absolutely. We believe that India can lead the way here. India has the potential to inspire the rest of the world when it comes to adoption of digital technologies in healthcare. India has already done quite a lot in this area. You are aware of Ayushman Bharat digital mission, which also includes Ayushman Bharat health accounts. So we see that India has made great strides in the area of digital health in terms of providing public health infrastructure, public health digital infrastructure, as well as working with the private sector to come up with innovative ideas and innovative solutions for healthcare. We saw already during COVID, India came up with CoWIN, which is the COVID vaccine
platform,
intelligent network. So that's something that was pretty novel, and that is something that was path-breaking. India delivered 2 billion vaccine doses within a very short period of time, and all of that was managed digitally. All of that was managed through this vaccine, COVID vaccine network. So I believe that India, has already shown the way here, and some of this is being taken up by other countries. For example, the CoWIN example, that's already being taken up by a few countries now. To manage their routine vaccinations, I think this is also happening in India. For example, you can manage polio and other vaccinations, maternal vaccinations through CoWIN network. So that's already happening. So now we are working with private sector as well as with the government of India, with the state governments, in terms of looking at how some of the work that's been done there can be further scaled up and can be taken up by other regions at the global level.
Okay.
Yes.
Speaking about partnership, of course, the World Economic Forum has a partnership with Apollo, and you are looking at this whole digital journey, health journey as well. What have been some of the specifics that you've been able to achieve in terms of tangible outcomes, and what do you hope to build on?
Yes, so we are working very closely with Apollo Hospital. Actually, I just published the Digital Health in India report together with Shobhana Kamineni, the chairperson of Apollo Hospital, which talks about our work in India and the potential of digital health in India. So we are looking at, how do we make some of the health data more interoperable, more accessible. As you know, you need health data, or you need data for AI to be successful. Fortunately, healthcare industry, the healthcare segment has a lot of data. Data is not a problem. The challenge is interoperability. The challenge is access to that trustworthy data, making sure that we are still following the regulatory guidelines. We don't want to misuse, or nobody wants to misuse the data, so we want to make sure that, that's under control. So we are working with C4IR, our Center for Fourth Industrial Revolution in Hyderabad, that we established together with government and private sector, and many of the companies, whether it's a pharmaceutical companies or hospitals, they are part of that C4IR. So we are using the C4IR to work with the government, to work with private sector, to see how we can solve for some of the challenges on the health data side, and then also use that data for the breakthrough digital technologies such as machine learning, AI, and agents to solve for the challenges that we face on the healthcare area, which are again on the access side, on the outcome side, as well as on the efficiency side.
You talked about some of the challenges that we're seeing in the healthcare sector linked to what is happening on climate change. But is there a concern that we're going to increasingly see less and less funding on healthcare, on issues related to healthcare, on the kind of research that is required, especially to address the challenges that emerging markets, developing markets face?
Yes, that's absolutely a concern. We want to make sure that there are sustainable financing avenues for the work that we are doing, whether it's preparing the health system to respond to the climate change, whether it's about bringing these technologies, bringing AI and other technologies to solve for some of the challenges we just talked about. So sustainable financing is an area that we want to pay special attention to, and you will see that there will be a lot of discussion with regard to sustainable financing for healthcare tomorrow, as well as for the rest of the week here. We have as a public session, a stakeholder dialogue that's focused on health systems. Sustainable financing is a core area of discussion during that public dialogue.
You talked about sustainable financing, and I think one of the concerns is that development aid is declining and is likely to even retreat further. What's the expectation now with President-elect Donald Trump taking office on what that could mean in terms of global health goals, global health financing as well, and the role you see the U.S. playing?
Yes, I mean, U.S. has played a big role when it comes to financing and comes to sustainable financing for global health, and we hope that will continue. We hope to see that continue. It remains to be seen how the policy changes, how the health policy changes once President Donald Trump takes over. But we are quite optimistic that some of the funding will continue and some of the financing will continue. Obviously, we will work very closely with him and his cabinet, with the new health secretary, to make sure that the global health area is well funded. So that remains to be seen. But we are also working very closely with philanthropies, with Bill and Melinda Gates Foundation, with Wellcome Trust, Rockefeller, and others, to see how they can continue to help in this area, as well as bring the private sector. As you know, our platform is public-private partnership.
Yes.
We continue to bring the private sector, the big Fortune 500 healthcare companies to this discussion, so they can do their part. But Shereen, I think...
Will companies now need to do more?
And
will philanthropies need to do more as well?
Exactly. Both of these segments need to do more. Put more resources behind this, and I think it's really important that private sector does its part here. And we are very encouraged in discussions with the CEOs of many of the big Fortune 500 companies that they are willing to step up and they are willing to look at this actually in a way which is more, I would say, democratized, which is also looking at not just the developed countries, not just the big markets, but also looking at global south, looking at low and middle income countries. How do we fund some of the healthcare transformation in those countries. So that's an area that's of special interest to us.
Okay.
Yeah.
Well, so if I were to ask you what you expect or hope for as a breakthrough in 2025, especially when we talk about healthcare and AI, the pace of change, the outcomes already achieved, but the outcomes that you hope for?
Yes, we hope that AI can be used more and better way to solve for some of the delivery challenges that we face, especially when we talk about the last mile, especially when we talk about the rural areas, difficult to reach areas. One example is e-Sanjeevani right there in India, where the government launched this program, I believe, during COVID, and has already reached out to 330 million people. A lot of these people are in rural areas, and this is through telemedicine. And we hope that we can make use of telemedicine, we can make use of AI to reach to many of these segments of population in Global South through breakthrough technologies. So that's an area where we believe AI can help us in a big way. The other area where I think it will accelerate and we would like it to scale up is on the diagnostic side, where AI is already being used in terms of cancer, breast cancer, and other diagnostics. But we believe it's just the beginning. It can be used in many disease areas, already being used on the tuberculosis, on TB side in India, where just by the sound of your cough, AI can tell if you have AE or not, if you have TB or not. So those kind of things I think will accelerate, and we believe we can, World Economic Forum, through our initiative, which is digital
but
healthcare.
But at a cost that's affordable? At
cost that's affordable. That's the main thing, and I think that's where the innovation that's coming out of India is very, very useful, because it's not only innovation that can reach masses, 1.4 billion people, but it's also cost effective. So we're trying to make sure that that's the innovation that we take out of India also to rest of the world, both developed and developing countries. So I think this is an area we would continue to work with India very closely, bring in the global sector as well, bring in the insights from other regions and at the global level. And we have an initiative which is called Digital Healthcare Transformation. India is part of that, so are many other countries, both developed and developing countries. That's designed for insight exchange. That's designed for activators, that's designed for doing work at the local level.
Right.
You will see next month in India, actually, we will launch this activator.
Okay.
This is a digital health activator focused on AI. And this is
So what will it do exactly?
So it will work with, again, government and the private sector to make sure that there is a good insight exchange, there is a good exchange of knowledge, of ideas, but also how do we create the ecosystem that really supports and helps in terms of scaling up some of these AI health solutions.
And is this a first of its kind?
This will be the first of its kind. We have many regions that we are going to launch these activators, starting out with India. We will launch it in UAE, we will launch it in other parts of Middle East, in Africa, in Rwanda, Singapore, and many other countries are lined up for this digital health activators that are being launched through World Economic Forum, through the Center for Health and Healthcare.
Well, that's wonderful to hear, and we wish you the very best of luck with the Digital Health Activator. The first will be launched in India, as you just heard from Shyam, Bishen, as well as some of the other exciting areas that you're working on to ensure that technology does deliver on the promise of doing good, especially when we talk about healthcare benefits. Always a pleasure, Shyam. Many, many thanks for joining us here on our live coverage here in Davos, and thanks very much for your time. Well, that was the healthcare sector's perspective, as well as the roadmap on what the future looks like. But we are going to take a break and continue with our conversations as we return. Stay tuned. You're watching CNBC-TV18 Davos 2025.